this current healthcare landscape is really absolutely unprecedented. High volume, high acuity, minimal available workforce. I mean, really, that's why we're all here, right? We've experienced shortages in the past in healthcare. It's not new, but historically, we've been able to draw from other skill sets to help support of certain functions. And what we're seeing here is really a widespread shortage that is impacting everything from food and nutrition all the way up to leadership. There's literally nowhere to draw from. So that's really made us rethink everything. Right now here in Rome, we're seeing the impact being the most affected at the front line. So all of your support services, food, nutrition, housekeeping, your nursing assistants, CNAs really struggled to entice them to stay or even to onboard. Lots of speculation as to why people are leaving, probably because it's a combination of vaccine mandates, fear of COVID, need for stable childcare. We're bouncing back and forth, remote, not remote. Other incentives and really reevaluation of work-life balance. And I'd be very curious to see if there's anybody on this webinar that hasn't rethought their work-life balance last 12 months, because I know that I certainly have. I'm very lucky to have a very supportive family because I literally have lived here for many, many hours and many, many weeks. And unfortunately, at the bottom line, the staff just don't feel like they're the heroes that they were once heralded as, right? That fundamentally, if you would ask me what the difference is about this wave, it really is just a sense of devastation and despair. Like where's the hope coming from?
I would definitely agree that when all this started, there was such a community focus around our healthcare system, and the level of support, whether that's just signage or advertisements on television. You don't see any of that anymore. It's kind of the expectation that this is almost status quo.
100%.
And I don't know if you agree with that or not.
Samantha, absolutely. It's just a very different feeling. And if you look back, I remember wave 1 came and passed, and we were anticipating wave 2. And I was like, I've got this. Like, I know what to do. We've done this. I'm ready. And wave 2, nothing like wave 1. And coming into this, and I'm not even sure if we're on wave 3 or wave 4 anymore. But every wave is totally different. And it's really just been a challenge.
It's a great point.
Yes, we've got a question from the audience too. How do you make your staff feel like they're heard?
Oh, well, John has jumped ahead. I think that's around slide 8. But no, I would say that this is it's so important to be high touch and how to communicate with your staff. So we do a lot of rounding. We actually implemented what we call an hour of rounding every day, where every member of leadership is out between 1 and 2 o'clock. And you're rounding on patients and you're rounding on staff. And it's our CFO all the way from housekeeping and HR. Everyone's out and about, touching base, finding out where people, their pain points are. Because as leadership, that's my job, is to get rid of the pain points. So I also connect through fireside chats. I have them on every unit, on every shift. Meet with the directors pretty regularly, but it is a constant presence being visible.
So it sounds like your answer is a lot, focused in on visibility, just in whatever way you can get it daily, especially with siloed work offices or siloed communities. How do we de-silo ourselves even just for an hour of the day?
And a lot of that was partnerships that we found. So I would go and grab the CFO and say, let's go for a walk and let's go around. Clearly something that clinical is a little more comfortable with than our non-clinical colleagues. Sure. But I also found that they were grateful because my head of PR would go up to the ICU and just kind of stand there and feel really uncomfortable. So our clinical leadership is really responsible for reaching out and saying, let's go for a walk. And I'm super excited that John asked a question. All right. I think we can go to, that's right. I can do this. Perfect. Work-life happiness. I really find it funny that someone felt the need to measure this. I guess it really is just to see just how much we have shifted. And honestly, looking at the poll results of has burnout been affecting you or your staff, it kind of reflects what we're seeing here on the graph, which is pretty exciting. A little validation there. But yeah, I don't think there's any question that COVID-19 has had a huge impact on the workers in the healthcare industry.
Yeah, and I think that's also, people have been really utilizing the term the Great Resignation, right?
Yep.
And that's definitely a big part of it is how are these stats feeding into these big macro trends?
I had a nurse leave to go make cheesecakes. She resigned to go make cheesecakes, and I actually value that. I'm grateful that she was able to follow her purpose, and because that was kind of surrounding our vaccine mandate that we have here in New York. But yeah, it's hard to compete with making cheesecakes sometimes.
It sounds great. I mean,
it's a really exciting job.
Can't be too much more to bring you happiness than that. Yeah, exactly.
I'm telling you, cheesecake brings me happiness. I don't know.
So Samantha, sorry about that.
I might leave to eat the cheesecakes, but I don't know about
Samantha,
making
I'm curious. With the mandate, has anybody come up to you, nurses, frontline workers, hourly staff, anyone in between, come up to you with issues surrounding the mandate itself? Whether it's resignation, whether it's other alternative options, anything like that?
We had to separate from about 2% of our employees because they did not get the vaccination. It was a really painful decision for them, and I will give you that. And they really struggled over it, and I get it, and I understand. But we went from a 10% gap to a 2% gap in about 6 weeks. And again, that was high visibility. That was getting our content experts out in front of our staff, answering questions, really just providing the evidence that was out there. So I would say that, we were successful. We were far more successful than some of our other colleagues. You might have heard in the news that there's a hospital just north of us that had to close their maternity department because of
my God. I mean,
and so we've been, so it's not a small task, so to speak. So for overtime, there's a lot in the literature about how much COVID-19 is impacting really the labor spend. And I can tell you that Rome is no different. There's a well-documented labor crunch. Daily, they're saying about an 8% increase in daily clinical labor costs for hospitals, which is translating into this 24 billion estimate here. It's a huge impact. It's really difficult to staff when you already have some workforce challenges. Now you have excess volume, excess acuity, and now you're competing with agency. And so there's bonuses and there's higher rates, and it's really just created this perfect storm that is unsustainable. And I don't think I'm telling anybody that anything they don't know, but that's where we're coming from. Sick time is up. We're seeing that now, and we'll talk about that in a couple slides. Some of the strategies we've put into place to combat sick. I get a report of every call-in and the reason why, and exhaustion is now just being listed as, and I get it. Like, it's a lot.
Where we asked if burnout has been a word that's been passed around in people's organization, and the majority of, non-surprisingly, the majority of the audience said, yeah, for sure. It's something where the word burnout itself has almost a new meaning to it this year around. And it's something that you hear, especially in the healthcare sector.
Right. I could say that I've always experienced burnout throughout my career. Like there's good times and bad times, and you just get tired and burnt out. I feel like this needs to have a different title, right? It's a different name, because the burnout of today, the burnout of 2021 is not the burnout of 2011.
Yeah.
All right. And so excess overtime is a burden for both you and your staff. One of the things that we realized very quickly is that our leaders were spending an exorbitant amount of time trying to fill holes. Really, that was their challenge every day, and we felt like we were chasing our tail. So not only are you spending more time in overtime, but it's the unmeasurable costs of the people trying to get people to fill those holes. We have seen a higher resignation rate, although here in Rome, we are starting to level off, and we are onboarding more than we're losing for the first time in a couple of months.
That's a silver lining.
There's a little ray of sunshine. Right? We'll take it where we can get it. They're saying 6.5 million people are leaving the job market, and really only 2 million are going to be replacing them. And that's a huge mismatch. If we're not sure that at least nursing is going to recover anytime soon. And then here at the bottom, 27 states will not be able to meet the hiring needs to counter the burned out, resigned staff. And I would even say, they were citing this study was citing some of the southern states as having more workforce than jobs available, and trying to recruit from the south. I can't imagine that every state is going to be facing.
I'm curious, for our audience members, for those that are currently in the South or working in southern state, if this is something that you guys have seen, feel free to drop your answers in the chat. We would love to engage with you all.
Yeah. Right. I saw Georgia and Maryland and South Carolina.
Cool. So moving on to a personal story from Rome. I know, Samantha, you had some interesting points about this. I'm really excited to hear more about it.
So we did a lot of strategies, or we're doing a lot of strategies, and being nimble and able to respond is probably the biggest takeaway that I could say. But we really struggled with our workforce and recruiting. People are offering sign-on bonuses and travel and wages. Like, it was something that we as a small organization could not compete with. So we took some time and met with our staff and met with our leadership to define what was different about us. And what we heard consistently is that our nurse managers, our nurse directors constantly were on the front line side by side. They would not let staff take an extra heavy load if they could jump in and help them out. So we really started this whole campaign about I've got your back and what differentiates us. And so this is just a picture of a Facebook ad that we had. This is Kelly West. She's a director of ED and ICU. And we included a quote from an employee who literally came back to Rome because of Kelly, because she had left somewhere else.
Wow, shout out Kelly.
Right? Shout out Kelly.
Yeah.
Kelly does need a little love. It's really hard to be in the emergency department right now. But so I would say find what's authentic and unique to you and advertise it. And this was a very inexpensive campaign through social media that we are starting to see some returns on.
Yeah, and I think that there is a lot of applicability there to industries as a whole, because what you're really doing is just trying to get people to feel like part of the team, right? And so when you have upper level staff coming down and assisting, that to me, if I'm on the front lines, I'm feeling better heard. I'm feeling more a part of the team than, taking orders from above, right? And as you're going through all of these overtime experiences and putting in the extra hours, a lot of the times I'm sure what's going in your head is, what's in it for me? Like, why am I doing this? Why is no one else helping me out?
Right.
But if I can see that on the floor, I bet that's where a lot of the, benefit comes from.
It closes that gap of disconnect we found. And also, the staff, everybody's tired, but they're not angry. They know we are doing when Kelly's in the front line and Kelly's in triage or taking an assignment, they know we are doing
that's
everything.
That's a very important distinction too, I think. When you think of burnout, you do think of stress, anxiety, and a lot of negative emotions that come with it, including anger, right? So, and it's not so much being angry at another person, it's more being angry at the situation. But even then, it's having that camaraderie as a team, as a staff, and making sure you convey that. I'm curious, have you guys used any employee feedback or anything like that to make sure that your frontline is heard so that people like Kelly can go in and help out?
So we have staff surveys that we sent out through SurveyMonkey. We have fireside chats. Our CEO rounds. There's lots of venues to give that feedback, but
for sure, yeah.
There's lots of different venues.
It's probably key just in making sure you maintain that visibility that we were talking about earlier.
Correct, and getting it different.
For sure.
Different cross sections of the organization at different times. So we'll do new hires. We do, I meet with every new nurse every month. So we have a nurse residency and they meet every month and I meet with them. And so there's a lot of ways that we can I get it from frontline leaders, like our clinical leaders or our charge nurses. That's a group that I engage with, as well as the brand new nurses. So kind of running the gamut there. Couple of other things that we've done that I just wanted to share. Leadership on the front line. We just talked about Kelly. Cross-training acute care staff. This was a painful lesson that we learned. I want to say it was wave 1, maybe wave 2, when we thought the sky was literally falling in, and we pulled all of our staff from the clinics and from perioperative services, and we spent a lot of time cross-training them to take care of this patient population.
Oh, wow.
And they hated it. They left acute care for a reason. So we have kept to cross-training acute care staff only, and they generally only go one place. So every nurse in the organization in acute care is cross-trained to work on 2 units at least, so they've got to work on 2, so they get specialized. But we found that much more productive, because actually we found especially in wave 3, when we closed if we had closed our primary care, then we would see more acute care patients. So we really pushed to try and keep our outpatient clinics open so that they could take some of the surge off of us. Daily metric tracking is really important. Find a couple of measures and then be consistent in measuring them. That allowed us to forecast what our volume would be. So I would say mid-August, I forecasted out through the end of October, and then I just went back and tracked that, and I was less than 5% off. And so that was really pretty interesting. So I remember being back in August going, there's no way we can sustain those volumes. And wow, guess we are right there at those volumes right now. And so that gave me some validation to reforecast out, readjust. And now I know how many staff, because we all have budgeted staffing patterns. You can't staff to those patterns anymore. You really got to staff to what's true. And our ER and our med surg and ICU volumes are all up. So that's what we're working on right now. Changing our skill mix. We very early on brought LPNs back into acute care to address the gap between the RNs and the techs because we couldn't get techs. So the LPN is that sort of tech person that's supporting the registered nurses, but also able to do even more. And they're super excited to be back in acute care because for about 15 or 20 years, they, at least in New York, they haven't been in acute care hospitals. So that's changing.
So you kind of have some populations that you're training that are excited and some populations that aren't.
Right. Well, everybody who's training should be excited, right? Because they're new to the organization. They're very excited. So we're really trying to capture that excitement and energy and translate that through the organization. And I'm running through these, and I'm sorry, I'm doing it very quickly, but I was just so excited to share. Improved workflows. We spent a lot of time, tasked our IT people to make, I mean, nobody loves their EHR. Roma's no different. But we really tasked our IT to improve the workflow and especially decrease the clicks. We have the cut out the clicks campaign. So we just want to make it easier for the frontline staff. We brought on admission and discharge nurses to help decompress our emergency department. This is really important because when you're asking people to sign up for extra shifts, they don't always want to take a full patient assignment, but to come in and do a couple of admissions or discharges, they're more than happy to do. And we can bring up our admissions before our discharges are out on the units. And then these admission nurses hand them off, packaged with a pretty little bow to the floor nurses. Employee health. Pretty early on, we recognized that we actually needed to change our focus of employee health. And so we renamed it our Employee Health and Wellbeing organization. We put some resources there for everything from employee appreciation to incentives to we're wrapping our EAP through this, having some forums, trying to really understand the toll that this has taken on our workforce. We're partnering with our surgeons. We are now changing the order of our surgeries, and those that could potentially go home same day are now going first. Because we found that sometimes even if it could be same day, but they don't get into the OR until 2 or 3 o'clock in the afternoon, we weren't being able to get them out in time. So we're really trying to decrease. The whole goal is to not let people that don't need to be in the middle of the hospital. The farther I find the farther they come in, the harder it is to get them out. So and then I will tell you that the largest impact we have seen is focusing on our length of stay. 100%. We used to look at this really just about once a day. We are now very laser focused and structured in looking at every patient 3 times a day to identify who can go. Because if we can decrease our length of stay, then we can keep the flow moving through the organization.
Awesome. I know Sandra actually had a question earlier.
So far?
She said, we are a company that provides service to medical providers and have gone fully remote. Our challenges are unique to a fully distributed organization. What have you done to engage your remote staff? It's a great question, Sandra, by the way.
It is. It's a wonderful question. We have not a lot of remote staff, but back in wave one, I would say anybody who could go remote did go remote. And a lot of that was still touching base more individually by the leadership,
right,
and having more of those one-on-one
we've all become technologically savvy in some way or
I've gotten so good at
whether
Zoom
we like it or not.
Great.
Right.
Some not so much. some more than others. I'll admit that. But you know, we found that engagement actually did change as long as the screen was up. And so when we were doing, even within the organization, we went to fully remote, I guess you would say. So all of our meetings were remote, even if we're in the same building. But on some meetings, it was a mandatory video. Like you had to have your video up.
I hear that a lot.
And that was much more engaging than looking at everybody's initials, right?
That's great. And then John had
I would say that that was our biggest strategy.
Issues filling shifts for understaffed staff members. So how have you made the scheduling process easier for frontline staff, maintaining coverage where you need it?
So, and I think we'll talk about that in in a slide or two. But the biggest thing that we did is we used to incent on bonuses on critical shifts. So and I'm not sure. So now instead we post our schedule in advance and post it with our incentives out farther. And we're actually talking about decreasing the incentive the closer it gets to the shift, because we really want to drive people to pick up shifts so that we can plan. Because we were finding that our nurse leaders were spending all of their time filling shifts for tomorrow or tonight. And that's that swirly spiral of death that I would call it. We just couldn't get out of being in the moment. So by putting it out there and incenting it,
right, that
people would be picking it up earlier rather than because they're smart, right? They wait. They know if they wait long enough, and then all of a sudden a shift is bonus, but I can't go because now I'm going to.
I'm curious, if you don't mind talking a little bit about it. What kind of incentives have you guys been offering your staff?
So it really depends on the unit and the need. Certainly we do have financial incentives for some of these critical shifts, but one of the other things is what's really important to staff, and that is money and schedule. So we have a Your Schedule Your Way coupon that for sometimes we'll give them that, you know, they can put they can say for this week that here's my coupon,
that's so
and
genius.
They can pick their schedule any way they want. Right, free. We also, I will offer first shot at premium time. So summers or Christmas to New Year's, you know, hey, if you do this, I'll let you pick your schedule first. You can put in for it first. Things like that.
Those are great. I mean, that definitely, every time right now,
those are the only three that come.
Somebody who's in the operations management side of things, but their incentives look like it gets more and more creative. So anywhere from coupon, vouchers, lottery type incentives. It really is. It's beyond. It's finding something that's beyond just offering a higher pay wage, because honestly, not a lot of us can afford that right now. Not a lot of companies can afford, let alone, you know, keeping on the remaining staff that we have. Right. Going back to the topic at hand.
Right. We're losing a lot of staff to travel opportunities, and that is something that we just can't compete with.
Yeah.
long-term strategies, we did a lot of partnering with our area organizations, our BOCES school for LPN, our nursing schools for RN. We created extern programs for rising seniors to come on board, and they can work as a tech for their senior year, and they get first choice of jobs, and they can actually start orienting earlier. We changed our tuition reimbursement to incent people. And I don't know why, but a lot of organizations say you have to work there a year before they'll pay you to go back to school or reimburse you. Why do we wait? Like, really, I would rather, our aides
100%.
become nurses far quicker and then wait than the 9 months. So once you pass your probationary period of 90 days, you are eligible for tuition reimbursement. And that was a huge thing here. Solutions to implement now. We talked about posting your schedule early to incent open shifts early. Don't get caught in that vicious last minute bonus cycle. Float pools are great. We have one. We incent ours 20% off of their base. They're happy because of the increased revenue or increased pay, and all of the other nurses are happy when they don't have to float. So that we found that to be a win-win. When we implemented this, we were nervous, or I wasn't nervous, but other people were nervous that we would have all the staff and nowhere to send them. And I can tell you that has never, ever happened. Everybody always has a place to go. And here's another incentive, a PTO discount. So this is something that we just implemented. That we found that we were struggling with call-ins. We were having lots of people call in, which really just disrupts your whole day. And other organizations were offering a bonus if you don't call in. So we didn't necessarily want to do that because we don't want people coming to work sick. But to incent our staff to pre-schedule their PTO or their vacation, we're offering a PTO discount. So if you call in for 12 hours, you use 12 hours. But if you pre-schedule your PTO, you get a 10% discount, and we're only going to take away 10.8 hours.
Right.
Because we really
that's a great plan.
Wanted people to we need to be able to plan. When you have 4 calls, it just and we're stretched very thin, so we just don't have that depth we used to have.
Yeah, I mean, that planning, it benefits the administrative side, but it also benefits the individual, right? Going into that point 3 with the communicating required overtime, I think at bare minimum, it's harder to stomach overtime when it happens as you're doing it. When you're thinking about going home at 8 p.m. and you end up having to stay till 12. Whereas if you already know that that's going to be the schedule, at least your mind's already wrapped around that idea, and the scheduling of that overtime is,
it's
key
huge
to avoid that burnout mentality.
Right. Nobody likes to be surprised.
No doubt.
So everybody's happier.
We do have a quick little poll question. We're curious if anyone in the audience, you guys use any technological advances to better schedule your employees. We're currently at a 50-50 split, so it's kind of interesting to see. Yeah, exactly. We need to see who comes out strong. Seems like a lot of people are saying no. That's pretty interesting. I'm curious to see, for those that are saying no, how big your organization is. If you think what benefits you think could be there. And I'm sure Bo can speak a little bit more on that.
Yeah, of course. Firstly, the first point on this slide that I wanted to cover is this telehealth practices, which truthfully, a little bit of a new concept to me, but I think it's interesting. Basically, what we're talking about is outsourcing certain, appointments throughout the day. And Samantha, you had brought up that psychiatry would be a main telehealth practice that we're trying to utilize in healthcare. What that essentially is shaping up to be is, maybe some of these staffing needs that we were thinking about, can we outsource that via telecommunication, where we don't have to bring someone into Rome themselves, or we don't have to bring someone into those 27 states who are no longer or not going to be able to fill these staffing needs. How much of that can we do via FaceTime or via Zoom? As we develop our technological understanding, are there more opportunities for us to utilize this telehealth practice? I don't know the answer to that, but would be curious to see what you guys think.
I think that there are, and I would say there are very few silver linings to COVID, but telehealth and the acceleration of implementation of telehealth into healthcare is definitely one of them. It's always kind of been looming out there, but nobody's really been able to take that leap. Well, we took that leap.
Definitely. We actually earlier this summer we had a webinar
Zoom,
on
I don't think it can go away.
Amazon and how it's disrupting the telehealth industry, because they're implementing a whole telehealth platform, at-home platform, even at-home care, and it actually stemmed from their own personal mini healthcare sector that they held in-house, essentially in company for their staff. And it's grown into this huge platform, and they recently launched it. And I mean, the industry alone, telehealth as a subsector of the healthcare industry, it's huge, and it's going to be huge, and it's consistently growing at a massive rate because of COVID. It's accelerated it immensely. Yep.
Yeah, definitely. So other two things too would just be, we need to plan. We've been talking about it a lot. We know that there are difficult things to deal with right now, but long term, we can't just keep pretending that it's unexpected. These are things we need to plan for, and things that, as we approach all of these new ideas, Samantha's been throwing out a ton of them, and it seems like the chat's really been enjoying them. When we try and implement these, we got to get feedback on it. The more things that we're bringing in and we're trying, are those solutions becoming receptible to our staff? Or are we meeting the problems we're trying to face? It just ultimately comes down to that planning, that feedback, iterative loop. I know during this, we brought up briefly, when we have these high demand time periods, those critical shifts, are we scheduling based on that demand? So making sure that, when we need people most, we're getting them, and then maybe, we're cutting them loose when we don't need them. Those overtime hours, they don't necessarily have to happen when we're not in those time periods.
Yes.
And one of the things that really key in that is you need to be able to identify who's in overtime, right?
Yes.
So it's trying to make it easy, and we want nurses to do nurse things and not, try and comb the schedule to figure out who's on overtime.
Right. Yeah, and when you're on the floor, that's a really difficult thing to manage. That's why we have these notifications up on the board too. Is if you can get some type of notification system going to allow your decision makers the opportunity to know, like, hey, this might be a correction that I can make right now based off of notification. I'm not proactively looking at anything, I'm just responding to information. That might be a good solution. Because it's all about adjusting. If we can get that information as it's coming in and make adjustments to it, then we can provide for a happier labor population, better utilizing our our resources, and just
this kind of goes back to Samantha, what you were talking a little bit about with your forecasting. Cool. And we could even see it in this image, this product image here. It really is about making sure that margin of error is as small as possible. And if technology can help, then so be it. But it comes down to how close we can get that margin of error to be as minimal as possible, right? And making sure that we are accurately collecting data and in turn accurately forecasting. I mean, it's it's something where one affects the other directly.
And I think one of the biggest things that I've experienced is when I'm not using a system like this, there's no source of truth. There's like there's a different schedule. So people show up when they're not scheduled and people don't show up when they're scheduled. And, again, that all creates angst and extra work. And given the very minimal resources that we have, we really need to keep people on what they need to do. And if we can leverage technology to make life easier so it takes the workload off, that is a win-win.